Hello my dear students, I'm Dr. Sangeeta Arya Tanwar and I'm delighted to welcome you to this course of clinical psychology. This is a very significant course that makes you aware of the mental health issues that have been on a constant rise in our society and need attention at a larger level. This course has been concisely organized to be covered in 15 weeks' time, wherein I will be making an extensive effort to help you develop an understanding of various perspectives, diagnostic criteria, and functions of professionals working in the realm of clinical psychology. This course not only includes descriptions and causes of psychological disorders, but also covers familiarity with the treatment modalities in the ambit of clinical psychology. The objective of this course is to create critical understanding of mental health issues and techniques in psychological and clinical inquiry. It is meant for developing skills and competencies of assessment, diagnosis, and understanding etiology of psychological disorders, as well as developing therapeutic treatment plan considering the causes and socio-cultural context. Here I introduce you with the week-wise schedule of the entire course. Week 1 will focus on the nature of clinical psychology and understanding abnormality. This introductory will be including 3 modules that will be explaining you the nature and scope of clinical psychology, various specializations in clinical psychology, and also help you understand the concept of abnormality or disorder. Week 2 will be including 4 modules that will help you develop an understanding of childhood anxiety disorders, conduct disorders, eating disorders, and elimination disorders. This week helps you develop an understanding of their diagnosis, causes, and gain acquaintance with the available treatment modalities. Week 3 will be comprising 2 modules giving an overview of developmental conditions and disorders. This week introduces elaborative explanation of different categories, assessment, causes and management of mental retardation and pervasive developmental disorder. When we go to week 4, we will be introducing you 2 modules that purport to familiarize you with the learning and attention-based childhood disorders. These modules are on learning disability and attention deficit hyperactivity disorder. This week, you are going to learn the diagnosis, etiology, and management of these disorders. Week 5 is predominantly dedicated to develop an understanding of major adulthood disorders based on anxiety, which will be including the description of their symptoms, etiology, and treatment. The disorders covered in this week are going to be phobia, panic disorder, obsessive compulsive disorder, dissociative and somatoform disorders. Continuing through week 6, working on 3 modules, we will be dealing with identification of stress and mood disorders. We are going to learn about different categories, symptomology, etiology, and possible effective treatment modalities. Week 7 will be including 3 modules dealing with psychotic disorders as conventionally categorized. The disorders covered in this week are going to be schizophrenia spectrum disorders, and delusional disorder. Week 8 will be a revision and assessment week for you in which you can revise all that have been covered so far. In week 9, we will be covering 3 modules that are going to be on sexual disorders, sleep disorders, and personality disorders. All these 3 modules will be comprising the symptoms, causes, and treatment of the respective disorders. Week 10, with the help of 2 modules, will be completely dedicated to the understanding of different kinds of substance abuse disorders, their causes, and treatment modalities. In week 11, we will include 3 modules, out of which 2 will be dealing with the various requisite functions of a clinical psychologist, which are namely taking clinical interview and developing therapeutic relationship with the client in order to resolve his or her mental health problems. While 3rd module will be dealing with the techniques of psychodynamic therapies, that is where the psychological therapies formally came into place with defined relationship and roles of therapist and the client. Week 12 will be dealing with 2 modules on behavioral therapy and cognitive therapy. In these two modules, we are going to learn about different techniques of treatments based on modification in thinking and behavior. Week 13 will include two modules on humanistic therapy and existential therapy. Week 14 will be comprising three modules and will give you an orientation about some non-clinical treatments of psychological disorders. The modules will be explaining about the yoga and meditation, transactional analysis and faith-based treatments. That is going to be the last week. It will be a revision and assessment week for you in which you can revise all that have been covered so far. On completion of this course, hopefully you will have learned significantly about all the possible domains in the ambit of clinical psychology. With this clear objective, let us start with the course. I wish you all the very best for the course. Thank you.